So I'm starting to do the videos on the vitamins and minerals and amino acids and phytochemicals and herbs and spices and everything else I take every day. And I'm starting with my multivitamin and what's in my multivitamin. And of course, the first vitamin is vitamin A. So the safe upper limit of vitamin A is 900 micrograms for men and 700 micrograms for women. But I'm going to explain why you shouldn't play with that. You should not be getting your vitamin A from animal sources, and I'm going to explain that at length in a little bit. It improves your immune health, it aids with night vision, it keeps the skin and the endothelium healthy. It's also extremely important in regulating cell growth and proliferation and differentiation. So it's very important at preventing cancer, as beta carotene, which is pro-vitamin A, which is in fruits, vegetables, and things like that. It's extremely important at preventing lung cancer in smokers. Now, the sources are, of course, dairy, eggs, the yolk of eggs. Only the yolk has the vitamin A, not the white. Oily fish, liver, beta carotene, of course, which is pro-vitamin A, which is in yellow and green leafy vegetables like spinach, carrots, pumpkin, sweet potatoes, squash, papaya, apricots, and so on. Now, of course, with me, I was eating a lot of carrots for a while, but the produce in my area really stinks anymore. So I use canned pumpkin now as my primary source of beta carotene. I don't really supplement with beta carotene because the pumpkin is so rich in beta carotene and the other carotenoids. I don't really have to, as long as I'm consistently eating pumpkin every day. Or not really even every day, I just a few times a week. It's more than enough. Plus I have, vitamin A retinol and beta carotene in my multivitamin. Groups at risk of vitamin A inadequacy are, of course, premature infants, and of course premature infants and young children in developing nations, pregnant and lactating women in developing nations, and people with cystic fibrosis. It prevents age-related macular degeneration as beta carotene, especially, this is what the research shows, especially in combination with ascorbic acid, which is vitamin C, vitamin E, zinc, and copper, and lutein. Vitamin A deficiency is a risk factor for contracting and developing the disease of measles and the morbidity from measles, meaning the death from measles. Acute excessive vitamin A poisoning causes increased intracranial pressure, dizziness, vertigo, nausea, headaches, skin irritation, painful joints and bones, and death, as well as coma. Coma usually before death. Also, brittle bones. Now, chronic overconsumption of vitamin A is what causes things like brittle bones and stuff like that. Now, I know about this personally because when I was about 17 years old, or 16 or 17 years old, when I first started taking omega-3 fatty acids, I thought I'd be wise and cheat the system and start taking cod liver oil. And I overdid it on the vitamin A. So I did get many of those symptoms. But luckily, this is back when you used to have to go to the library to learn things. So luckily I went to the library and realized I was way overdoing it on the vitamin A. I had cracking, bleeding skin all over my lips and face and eyes. My eyelids were flaking off. It was really disgusting. Luckily I did catch it before it developed into like severe health concerns. But this is why you should be seeking your vitamin A more so from beta carotene and the other carotenoids. Now, the other carotenoids are not necessarily pro-vitamin A, like beta carotene is. However, what you have to understand is beta carotene works best synergistically with the other carotenoids. such as alpha-carotene, lycopene, zeaxanthin, lutein, etc. Or lutein. So that's what you need to keep in mind. Now, of course, I'm not a doctor, I'm not a nutritionist, I'm not a nurse, I'm not any of that stuff. So, of course, I'm going to leave a similar disclaimer in the description of this video. But, of course, the vitamin A and the other vitamins, minerals, amino acids, phytonutrients, etc. work synergistically with one another to promote health and well-being. And that's the whole concept of orthomolecular medicine. That's the whole concept of the triage theory of aging and disease, Dr. Bruce Ames' triage theory of aging and disease. And it's very important to understand that, because it's not one vitamin or two vitamins. Okay, because there's a lot of people, like Linus Pauling he had a hard-on for vitamin C, and Abraham Hoffer had a hard-on for niacin. But no one vitamin is any more important than any other vitamin. It's a matter of using them synergistically with one another, sometimes with megavitamin therapy, meaning a lot of a vitamin. But again, if you need a lot of vitamin A, you should not rely on retinol. You should not rely on vitamin A palmitate. You should not rely on animal-based vitamin A. You should rely on plant-based vitamin A, not animal-based vitamin A, because the beta-carotene and such, that's not really associated with these disease states from the overconsumption of it. At the most, your palms, I've done that too, your palms of your hands and the pads of your feet might turn orange or yellow, and you might look jaundiced. But it's not necessarily jaundice. It's from the overdose of beta carotene, which stores in the fat in your skin. Again, I'm not a doctor. This is not health advice. Do not seek health advice from people on YouTube. Seek health advice from a licensed healthcare provider if you have a medical issue. And that's all for this video. Similar disclaimer in the description, links in the description. Follow the links, learn what you can, and that's all for this video.